I wasn't actually going to become a PT. First thing was I really wanted to become a aerodynamics engineer. And I was going to go to Art Center for automobile design, and then pivoted because I didn't want to sit in the office all day. So, but I still love motorsports, so I kind of pivoted, went to San Diego State for my undergrad, and then ended up going to Touro University for becoming a PT. I decided to come to HealthFit because I was sick of the insurance grind. I've noticed that our healthcare system is a little broken, and it doesn't actually prevent people from having injuries. It just kind of keeps them going until they get to a point where they can't fix themselves. And I came here because I actually want to treat people and get them through so they can actually meet their goals and actually feel better about themselves. What stood out to me was, I think, the community and like the culture they have here. Everyone has the same mindset, and then the same amount of goals they want to achieve. And I think that gives a really good culture to get to a point where you can treat your patients the way you want to treat them, help them meet their goals, and everyone's always, trying to make you better. I think the most important thing is to let your patients know that you're on their side and you're going to do whatever you can to kind of help them meet their goals. And whether or not they get close to their goals, you're really trying to find other clinicians or other healthcare professionals or whoever else they're looking for to really get them there. I did have a patient recently that had like 30 years of back pain, and no one was really able to figure out what was going on until I talked about, women's health and pelvic floor and things like that. So I don't specialize in pelvic floor, but really got them to have a higher baseline to really kind of minimize the pain. And I wasn't into myself where, I helped them refer out to a pelvic floor specialist, and not a lot of physical therapists do that because they have really big egos and they think that they're the one to really fix the patient. But really, having a patient feel better is to really just make sure you work well with other professionals to get them to meet their goals. So I had a patient come to me, and he went through like 6 surgeons for his hip, and they did scopes, they were about to do a total hip, and he really didn't want one. And the main thing that he was having trouble with was bending down to pick up his grandson. So really worked with him for 8 weeks or so, and gotten to a point where he can actually pick up 30 to 40 pounds from the floor. And over July 4th, he told me, hey, I picked up my grandson and I had no pain in my hip. And I was like, look, that's the first step, and that's what we're going to go for. And from then on, he really excelled, exercise without pain, starting able to jog a little bit now, and he's like 88. So anything's possible. Bringing a lot of laughs and jokes and just trying to not be too serious with things. And I think that everyone needs to kind of have a lighter note and really try to be that one person that says like, hey, like, we don't have to take things too seriously all the time, and you want to have fun while you're doing this. And also, try to bring a different flavor into having people meet their goals. First visit, I'm always going to ask about how, not just their injuries, but everything outside of their injury, like, the social factors, like how whether sleeping, eating, stress levels, those are the 3 biggest things I always ask, because everyone thinks injuries are physical, but a lot of it can come from outside factors rather than just personal injuries. HealthFit's different because you're given the time to really understand your patient and see them in front of you and treat them for who they are, rather than seeing 4 or 5 patients an hour and you're really just trying to hit productivity levels at that point.